If you are preparing for your golden years, now is the time to develop the best strategy for the second half of your life. The Aging Master Plan, which is being implemented across the United States, is not just a government policy. It is a comprehensive roadmap designed to help you age with dignity in the way you want and where you want. Many people have concerns as they age. Will healthcare costs become unaffordable? Will I be able to continue living in my home? Will I have access to care services? Will I be financially secure? These concerns are not unique to you. To address these real-life concerns, many states are trying innovative approaches. California's Aging Master Plan is leading the way, created to address the reality that nearly 10 million Californians will be 60 or older by 2030. That's a staggering 1/4 of the state's population. But the importance of this plan isn't just about the numbers. It's about the real impact it will have on your life. California's master plan outlines 5 key goals. The first is housing for all ages and stages. This doesn't just mean building more senior housing. It means ensuring that as you age, you can live in a housing environment that is accessible, dementia-friendly, and resilient to climate change and disasters. This includes housing models for attached units and multi-generational families. In fact, as of 2025, California is pursuing federal approval for housing support services. This would expand Medicaid benefits for housing support services so that more people can access them and utilize federal funds. Additionally, the state is requesting a one-time general fund allocation of $150 million for senior housing and disability advocacy programs. The second goal is reimagining health. This means ensuring that you can access the services you need to maintain optimal health in your home. Reforms are also being pursued to raise the maintenance of income level for Medicaid cost-sharing programs to 138% of the federal poverty line. Currently, this program forces seniors and people with disabilities to live on $600 a month to access Medicaid services, pushing them into severe poverty. The third goal is inclusion and equity, not isolation. As we age, we should have lifelong opportunities for work, volunteering, participation, and leadership, and be protected from isolation, discrimination, abuse, neglect, and exploitation. This is not just a slogan. In California, legislation is being proposed to provide alternative delivery methods for elder abuse restraining orders, and a bill is also in progress to require the disclosure of staffing levels in long-term care facilities. Fourth is effective care. People should be prepared and supported to care for their aging loved ones through the rewards and challenges of caregiving. The goal is to create 1 million high-quality caregiving jobs. In fact, nearly 5 million family caregivers in California are helping their loved ones with daily tasks. This work can be deeply rewarding, but it can also pose serious challenges for those who perform it. The fifth is retirement savings. Everyone should be able to enjoy economic stability throughout their lives. To achieve this, a budget request is underway to increase the personal needs allowance from $35 to $50 per month and to index it annually to the cost of living adjustment administered by the Social Security Administration. Additionally, $156 million is being requested to provide ongoing annual cost of living adjustments for SSI/SSP benefits. However, California is not the only state attempting this innovative approach. New York State also launched its statewide Aging Master Plan in 2022. New York State has 4.6 million individuals aged 60 and older, the fourth highest in the nation, and this number is projected to reach 5.3 million by 2030. New York's plan aims to ensure that all older adults and individuals of all ages can live healthy, fulfilling lives with dignity and independence. Pennsylvania also developed a 10-year roadmap called Aging Our Way, PA, in 2023, under an executive order by Governor Josh Shapiro. This plan includes priorities, strategies, and tactics to improve services for Pennsylvania's older adults and meet the needs of this rapidly growing population. Pennsylvania is the 5th largest state in the nation, home to 3.4 million older adults. Missouri also announced an executive order in 2023 to establish an aging master plan to reduce age and disability discrimination, remove barriers to safe and healthy aging, and help Missourians age with dignity. Missouri held one in-person town hall and 2 virtual town halls in each of its 10 senior services regions in February and March 2024. A total of 1,769 participants attended the town halls and provided more than 15,000 comments. Currently, only 5 states, California, Colorado, Texas, Minnesota, and Massachusetts, have fully developed and begun implementing their plans. Vermont is developing its plan but has not yet launched it. In addition to New York, 9 other states, Oregon, Washington, Hawaii, Michigan, Illinois, Florida, New Jersey, Connecticut, and Maine, and Washington, D.C., are considering developing aging master plans. By 2030, approximately 73 million baby boomers will be 65 or older. This is not just a demographic change, it is a change that will directly impact your life. However, there is no need to fear this change. Instead, you can use it as an opportunity. Aging in place, staying in your home as you age, is what many Americans want. According to the National Institute on Aging, many people want the same things as they age: to stay in their homes, maintain independence for as long as possible, and rely on family and friends for help when needed. However, this requires careful consideration and planning. The most important thing is to plan ahead. The best time to think about how you want to age in your home is before significant care needs arise. Planning ahead allows you to make important decisions while you are still able to do so. The first step is to consider the types of assistance you need now and what you may need in the future. Local senior citizen agencies, regional and state senior citizen agencies, social services, or tribal organizations can provide a list of services. These organizations are familiar with the resources available in your community and can offer tips on how to access them. Healthcare providers and social workers can also make recommendations. If you belong to a religious community, inquire about services for seniors, or ask your pastor, rabbi, or other religious leader for guidance. Getting help during the day is also important. Support is available if a regular caregiver is not available during the day. Some organizations have volunteers who make regular short visits to seniors. Volunteers can provide support, assistance, and companionship. You may also consider adult daycare programs that provide social activities, exercise, meals, and personal care during the day. Meal delivery services are also an important option. In some cases, eligibility for the service may require meeting specific criteria, which may include age, mobility, and financial need. Medicare generally does not cover meal delivery services, but may provide this benefit for a short period in certain situations. Medicaid may cover some meal delivery services if the person is eligible. Many state and local agencies, nonprofit organizations, and companies provide transportation services for seniors. Some senior housing complexes and community groups also offer ride passes. Public transportation agencies often provide discounted fares and other services for seniors and people with disabilities. Many communities also have taxis, ride-sharing services, and other transportation resources available. Home health services are another important component. If you have recently been discharged from the hospital and still need nursing care at home for a short period of time, the hospital can help arrange for a home health aide. Home health services can also help manage chronic conditions such as diabetes. For example, they can test a person's blood sugar or administer insulin through a pump. However, these services come at a cost. Home health services charge by the hour. Medicare provides limited coverage for home health services. The services must be short-term and provided by a Medicare-certified agency. Medicaid also offers coverage for home health services, but these benefits vary by state. Most private health insurance plans do not cover these costs. These practical challenges make aging master plans even more important. These plans take a systematic approach to problems that are difficult to solve individually. For example, California has been asked to develop a plan by January 2025 to identify revenue sources for statewide benefits for long-term services and supports. Rental assistance programs are also an important issue. Rental assistance programs are a proven model for stabilizing housing for older adults and preventing homelessness. The longer we wait to implement statewide programs, the deeper the homelessness crisis for older adults will become. Analysis of current programs and proposed expansions should be a priority this year. Expansion of successful programs to additional counties should be planned for 2025 and 2026. Elder abuse prevention is another critical area. The Illinois Department on Aging provides home care and community-based services to older adults who cannot live independently. It also operates an advocacy program aimed at protecting and improving the quality of life for long-term care residents. The department responds to reports of abuse against older adults and people with disabilities living in the community and provides free, unbiased insurance counseling for Medicare beneficiaries and their families. The New York State Office for the Aging's home and community-based programs are designed to support and supplement informal care by enabling older adults to access well-planned and coordinated packages of home and other support services. The overall goal of the New York State Office for the Aging is to improve access to and availability of appropriate and cost-effective non-medical support services so that older adults can age in their communities and avoid higher levels of care and publicly funded care. In Texas, the Aging and Disability Resource Centers can help seniors and people with disabilities find and apply for long-term care programs. The Texas Health Information, Counseling, and Advocacy Program can help find information and enroll in Medicare, Medicaid, and long-term care. Local aging agencies can help find services for people 60 and older, their family members, and caregivers. While these programs and services exist, many people are unaware of them or do not know how to access them. This is where the true value of aging master plans comes into play. These plans do not simply create new programs, they integrate and coordinate existing fragmented services to ensure that people receive the help they need. For example, California's California for All Ages Action Day focuses on two critical structural reforms: home care systems and ending homelessness for older adults. This is not just about providing relief. It is rooted in the practical need for families and communities to have access to affordable care systems that are sustainable over the long term. One of the most important things you can do right now is to find out what plans and services are available in your state. If your state has not yet started a plan for aging, you can write to your state legislature and governor to ask why and urge them to begin. Provide examples of what other states have done and suggest a few things you would like to see included in the plan. At the same time, you can start preparing on a personal level. Begin by walking through your home room by room to identify potential problems and safety issues. First, address immediate hazards such as loose stair railings and insufficient lighting. Then work on other ways to make your home as safe as possible. Talk with family, friends, and other caregivers about the support you will need to remain in your home. Be realistic and plan to revisit your decisions as your needs change over time. Consider conditions such as diabetes and heart disease. Learn how these conditions could make it difficult for someone to get around or care for themselves in the future. Finally, remember that aging is a bipartisan issue that affects everyone. A good master plan brings together government, nonprofit, private and public organizations, community groups, and individuals to rethink how services are designed, funded, and delivered so that all older adults are served equitably. Aging is not a numerical value, but rather a continuum and an ecosystem. Your future depends on the choices you make today. By leveraging an aging master plan and the opportunities it offers, you can age with dignity and independence in the way you choose. This is not just government policy. It is an investment in your later years and an effort to make your community a better place for people of all ages. That's all for today. Thank you very much for watching until the end. We will continue to bring you more useful information on how to maintain happiness in your golden years. Please subscribe and like our channel to show your support. Thank you.